Kia ora everybody, my name's Dee Telfer. I'm the Acting Director of Nursing and Midwifery for Northern DHB. So tomorrow is International Nurses Day, and also coinciding with the 200th anniversary of Florence Nightingale. What we thought we'd do is do something different and bring three wonderful nurses from different backgrounds, us as an interview panel. We've got a set of questions for them, and we would like to know what their perspective is on these questions. So first of all, we've got Denise Manning. She's our duty manager from IOC. We've also got Judith Hapi, which is a clinical nurse manager of Ward 2. And we've also got Robyn Martinovich, district nurse from Dargaville. So thank you everybody for turning up today. So first of all, Denise, first question is, what inspired you to become a nurse?
Kia ora Dee, and happy Nurses Day to everybody for tomorrow. Now, I'm not quite as old as Flo, but I have been nursing 46 years, started nursing 46 years ago this year. I'd always wanted to be a nurse. Nurses have been in my family for a few generations, so that's what inspired me. But also the opportunities for travel and the diverse work options made it a very good choice for me at the time.
Thank you. Jude.
Kia ora everybody, and happy International Nurses Day for today. Thinking about what inspired me to become a nurse, I think that I think a bit like Denise, it's something that I've always thought about when I was younger, but I just think I've always been a natural nurturer and really a people's person. So I guess it made sense to kind of marry that up and become a nurse. It was really about wanting to make a difference in people's lives. Yeah, so, and I guess my nan was also a nurse, so that played a part in it as well.
Thank you. Robyn.
I love problem solving. So a lot of part of nursing is being able to identify a problem and why is that happening, and being able to pull it apart and take that real wider look at being able to help and support people to be as well as they possibly can. So yeah, it's always been a dream to do the nursing, and finally got there. So
Great, thank you. Okay, so what do you enjoy most about working for Northland DHB?
From my perspective, I came from Auckland City Hospital to a reasonably sized job there, and I had been looking to come north for many years, and when the opportunity of a duty manager role came up, I jumped at it with open arms. And I think for me, it's the diversity of the duty manager role, the fact that you can work across a whole organisation, plus you touch base with the whole of Northland in terms of our rural hospitals. And I think the fabulous colleagues that I work with, it makes all the difference in the world, and the patient and staff contact. And I also have great admiration for our staff here and their adaptability in these unprecedented times. That's my main ones.
Thank you. Jude.
I was going to say Winding Wednesdays.
So, yeah, you're so right.
I think what I enjoy most about working at the DHB is actually the people. Like, I really enjoy that it's a smaller hospital. I started here as a new graduate nurse, and so I've made some amazing friendships and really positive working relationships. I also love working with our community in Northland. So they're great people, really down to earth and humble people. So I really enjoy that. And also I think that working in a sort of smaller hospital away from, with less resources, that I really enjoy the fact that we've got really innovative people, and we have to think about finding solutions and having to utilise, I guess, our own skills to improve our services with the resources that we have, and I think that we do that well.
Thank you. Robyn.
I love the teamwork that we have with the Northland DHB. I love collaborating and working with the other services. And the fact that we are, well, in Dargaville, we're rural, so we have that connection with our patients that you wouldn't get in the bigger areas. So yeah, I really enjoy working in this area.
Great, thank you. So what major changes in nursing have you seen since you started in the profession? I'm sure, Denise, you've seen quite a few, being 46 years into the job. What have you seen?
Yeah, it's been huge, really. You compare the 70s to now. When I first started nursing, you still wore the old starched uniform that you had to put the buttons on, you wore a hat, you worked more on an apprenticeship basis than anything else. So you started at the very bottom, but you got paid a little bit for doing it, and you went to study days at the School of Nursing periodically, which was, look, for me, it was a great way to learn. But you did start at the bottom. We were called rounders, really, because you did sluice room rounds, you did sputum mug rounds, you did tooth mug rounds. And then you finally got to look after your patients. And I think going back then as well, we were round focused as opposed to patient focused. So you could only go to the loo every 2 hours. In between times, it became inconvenient if somebody wanted to go. Also, you didn't have things like technology wasn't there because you didn't have IV pumps. So you actually had to stand there and count the number of drips that you wanted to put fluids in over your hourly basis. You mainly did IM injections for your antibiotics. So as a student, you had to set those up, and then the RN, the staff nurse, would come around and give those because we weren't allowed to. Look, we have a lot sicker patients now than we did in those days. Patients stayed in hospital a lot longer. Their little fractured neck femurs were there for 6 weeks, and so you had your ongoing complications from things like that. Today, I think we're much better staffed than we were in those days, and also the technological advantages that we have these days have made a huge difference in our nursing. Thanks, Dee.
Okay. Jude.
I've been nursing since 2004, so I'm kind of like nearly 16 years. And I mean, I think that in healthcare, it's constantly evolving and there's lots of changes. If I think about things that are really important to me, if I think of 2 things that are quite important to me and kind of align with my values, I would say the first thing is I've really liked how things have changed in terms of we used to be quite system focused and how it would work for us and how the health model worked for us as people that worked within the DHB, but now we've become a lot more patient focused and it's all about them and what actually matters to them. And so I think that's fantastic change. I also really like the fact that they now, because this wasn't a thing when I started, I mean, there was talk about it, but around the reducing inequities and the lens around that and how we look at how we're going to reduce that, and that it's we really need to make those changes. And so I think that's also really important. So if I pick 2 things that really stand out for me and that matter to me, those would be the 2 things.
Thank you. Robyn.
I think the fact that nurses can now specialise in areas and we can educate ourselves, you know, to that point of nurse practitioner or whatever, it's just phenomenal because we're amazing and we're smart, and to be able to utilise that and specialise in something now, I think is awesome.
Okay, great. Okay, so if we could change or improve anything, what do you think it would be? What would it be for your perspective?
I think I'd love to see students have more practical experience. I know they get a reasonable amount now, but I think the ongoing integration into our hospital or other healthcare systems is really important before they actually get on the floor as registered nurses. And I think to continue having our patients as part of decision making for their healthcare, and leading on from that, I think, as Jude said, continue to reduce the health and inequalities in health is really important. We've got a broad population group out there with broad ethnicities, and I think we have to take more consideration for how they feel about their healthcare and what they want to do going forward. Back to you, Dee.
Jude?
Okay. I guess it's an interesting question. So there's so many things that you'd kind of like to want to change, but I think on a bigger level, I think it's really about working together. Like, I just would like there to be less sort of silos and there be more inclusiveness and working together within the organisation, because I think we need to always remember that it doesn't matter where the patient is in whatever department, whatever area they are, and as they move through their journey, that patient is everyone's patient. So I think that's important. And I've got to say this, if it's not just working in silos for people, when we think about systems and computer systems talking to each other, that would be another great thing as well. I think it would make everybody's job a little bit easier.
Thanks. Thank you, Jude. Robyn?
I think as nurses, we get so busy caring and looking after everyone that we don't look after ourselves that well. I think it would be nice to see if there was a little bit more understanding and education around the health effects of shift work on nurses, and how we can better look after ourselves so we can, be there to be able to look after everyone else.
Okay, thanks.
Nice.
All right. What would you say to a person considering a career in nursing? We need to recruit, we need to add to our pipeline. What would you say to people in regards to taking up nursing as a career?
For me personally, it's been a wonderful career path. I wouldn't have done nearly as much as I've done from a travel work point of view if I hadn't been nursing. It gives you the ability to diversify within nursing and to go into other things if that's what you want. I know it's hard work for people. Any sort of study, ongoing study is difficult, but you have that wonderful ability to work with people who have been in the system for a long time, who are prepared to teach students from a practical and theoretical level, and the fact that they get to know a broad group of patients. It's got to be a great career to be in.
I agree.
Yeah. Yeah, absolutely. I know this sounds a little bit cliche, but actually it's I feel like it really is a privilege. Like, I've learnt and grown so much, not just as a nurse, but as a person. I think throughout my nursing training, I did this, I think, for myself, but also to be a role model, I guess, for my family, about following something that you feel passionate about, like doing what you love. And I think that's important. And just, if I think about when you move into it, it's like thinking about getting the mix right between having really good skills and knowledge, but also not losing your compassionate heart. I think that's really, to me, when I think about nursing, it's about caring profession and not forgetting that. So yeah, like, it's really rewarding that you can either, like, it's so broad, you can, no matter if you're not happy in one area, like you feel like you want a challenge, you can always move to another area. But ultimately, I just think it's an amazing career, and it is definitely a privilege.
Thank you. Awesome, Jude. Robyn?
I say go for it. I mean, persevere too, because it is challenging and it can be hard, and make sure you've got those good whānau supports in place to help you through the tough times, because it can be tough. But yeah, I don't think you'll find a career that's as rewarding as what we do every day.
Nice.
Fantastic. Well, there we have it. We've had 3 wonderful nurses give us their views on those questions, and I thank you very much. Definitely value your kōrero. And as for everyone, I'd like to, on behalf of the Northern DHB and myself, I wish you the very best International Nurses Day tomorrow. Yes, we celebrate it one day in the year, yet we do amazing work every day. But this is our day, and I take my hat off to every one of you. Your dedication, commitment, loyalty and leadership, I definitely value, and alongside the rest of the DHB. So thank you very much, everybody, and have a good day.